over the years, the technology for type 1 diabetes has been improving by leaps and bounds. So kids get to use, instead of having to, or adults too, get to use the technology also, but instead of having to stick their fingers all the time with their traditional checking their blood sugar with a meter and a Lancet device, is a lot of kids like to use these continuous glucose monitors. And so most commonly, a lot of them are using the Dexcom, which they wear for 10 days at a time. And so instead of checking your blood sugar maybe 4, 5, 6 or more times a day, because children that take insulin with type 1 diabetes or even type 2 diabetes are having to check their blood sugar before every time they eat, before they go to bed, sometimes in the middle of the night, oftentimes when they're active and they feel like their blood sugar is going low. So that can be a lot of times a day that they're having to poke their fingers. For Dexcom, the company actually says that patients should be wearing this on their abdomen or their upper buttocks, but I'm going to put this on my arm today just because for the video's sake, I don't want everyone to see other parts of my body. And so Ms. Juanita will talk you through what she is going to do.
Then you want to use alcohol. And remember, this can be placed on the back of the arm, the same place that insulin injections are given. And then you want to make sure it's good and dry. While that's good and dry, you can be setting it up on your phone, pairing it with the information and all that while it's dry. And it takes alcohol about 20-30 seconds to really dry. And once it's dry, you just peel off of the bandage that to be exposed and you're ready to go. It has a lock on it, so you won't prematurely press it while you're working with it. And then when you're ready, you just click it off. The next step, finding the spot that you want, and then just push in so the bandage will start to adhere first. Then you press the button just like a finger sticker. And that's it. It's all in. And then you want to put some body heat around it so the bandage will stay. And your last step is to attach the transmitter that actually talks to your phone or to the receiver. And it just, that's it. And she's ready for 10 days of wear.
Like she mentioned, this can actually talk to the cell phone. And so the options could be the patient, or in our case, the pediatric patient, the child, can have an app on their cell phone that the Dexcom will talk to the app and tell you what your blood sugar is. It's checking your blood sugar every 5 minutes. So before, if you're just checking your finger, you're only getting a blood sugar at that one point in time. So it gives you some information, but not a lot of information. And then the parents can also have an app on their cell phone that the information can transmit to. So the kids can be at school, the parents can be at home, and they can still get the information to know what their child's blood sugar is. So this technology has really just revolutionized like diabetes care. In addition to telling you your blood sugar at that moment, it also gives you an arrow and it tells you if your blood sugar is rising, if it's steady, or if it's dropping. And so it really has helped patients really take more ownership of their diabetes and helps them know kind of in planning what their blood sugar is doing, so they can make better decisions about their insulin dosing, about what activity levels they're doing, and how they should prepare for that. And so just this technology is just amazing. Type 1 diabetes, or even now type 2 diabetes in kids, it's a lot to deal with. It's a lot of work, but this technology is just making it a little more manageable for them, and it allows them to be more knowledgeable and to be more empowered to make decisions about their diabetes. We have seen an increase in diabetes during this COVID pandemic. We have been admitting more patients in the hospital here in Macon, all over the state of Georgia, and this has also been noted in other states around the U.S. and other countries that has been being researched. And so please, do not shy away from going to your doctors out of fear. If your child has any of these symptoms, please do not hesitate to get them checked out.